Hi, my name is Garrett Gooch, and I am here today to present my proposal in regards to STI and HIV prevention in Wayne County, Michigan. Let's get into it. The rate of newly recorded sexually transmitted infections partnered with HIV in Wayne County, Michigan is growing steadily to the degree that the Michigan Department of Health and Human Services has declared it an epidemic. While current data lists gonorrhea, chlamydia, and syphilis as the most prevalent STIs in the area, there is a significant increase in the newly recorded cases of gonorrhea and syphilis. To add, Wayne County has significantly higher infection rates compared to the national statistics as well as those of other neighboring counties. In 2019 alone, the U.S. reported 2 million new cases of STIs, 6,813 of which were from Wayne County alone, equaling 0.3% of the national total. However, the 2 million new cases are inclusive of new cases of HIV, which total 36,801. Therefore, the 6,813 cases that were from Wayne County are inclusive of 285 cases specific to HIV. This statistic ascertains the need to prioritize an evidence based intervention to curtail the problem. Among the diseases reported in Wayne County, chlamydia was the most prevalent. Not to underestimate the impact of prevalence of other diseases, the high representation of chlamydia cases calls for further background checks on the matter. Chlamydia is caused by Chlamydia trachomatis, which has more damaging effects on women compared to men. Typically, most women infected with chlamydia are highly susceptible to pelvic inflammatory disease and stand a greater risk of having an ectopic pregnancy. To add, gonorrhea has effects that are similar to those of chlamydia on its patients. Women suffering from gonorrhea risk what's called a tubal pregnancy, and in worst cases, infertility. Syphilis was the third most prevalent and poses a higher risk of contracting HIV with its patients. Individuals diagnosed with syphilis are 5 times more likely to contract HIV compared to patients without. These identified STIs that we've just gone through, according to data, are often co diagnosed with HIV about 45% of the time. Although the impact that STIs inclusive of HIV have on individuals add more of a care load to the healthcare system. Consequently, reducing the prevalence of these infections would translate to a reduced burden on the individual health and dependency on the healthcare system. Now, the primary steps, or I should say, the primary step toward increasing the understanding of a condition and the nature of a certain disease among the public, it starts with awareness. Researchers advocate that awareness campaigns have the ability to raise the general level of awareness amongst the masses regarding a particular disease. Besides, an effective awareness program touches on all of the involved stakeholders. It raises the public's ability to seek medical attention. As such, creating awareness through touring across all healthcare facilities in Wayne County will heighten the level of awareness regarding HIV and STIs. Besides, the awareness campaigns can also be conducted at community events as well. The main points of awareness include sensitizing the masses on regular HIV testing, same thing for STI testing, and safe safe sex practices, the use of contraceptives, and encouraging the use of PrEP medicine. Sensitization and awareness will have a significant impact on the marginalized population in Wayne County. Nonetheless, there may be various barriers that may hinder the access of quality healthcare amongst the marginalized people. Some of those identified barriers fall into the categories of misdiagnosis, superficial relationships in the community, the lack of confidentiality, as well as poor quality of care. The program that I am proposing aims to bypass such barriers by creating flexible schedules that will consider individuals who may be working more than two jobs, as well as introducing an online campaign to maximize the reach of the awareness program in remote areas across Wayne County. Also, training. The training of peer leaders will leverage the awareness program success. To ensure a successful rollout and overall implementation, the program will take a multidisciplinary approach through a team containing physicians, nurses, mental health experts, receptionists, volunteer, marginalized peer leaders, and an IT support team. We want to make sure that this program is supported and that the community can feel the support. So there are no gaps. But how do we ensure that there are no gaps and that we are meeting the needs of the community and et cetera? The program is going to be brought into realization by adopting the following measures, in my opinion. Excuse me. We must conduct surveys and use survey responses to gather insights regarding the level of awareness of the community. This is going to help us in the identification of specific knowledge gaps that the program will need to focus on. Besides surveys, will also be issued on the members of the community to draw the perspectives on the community's perception of the program after rollout. We want to make sure that they have a clear perception of why we're even doing this. This will help us to draw insights on the need to leverage more community buy-in. Also, the next point that I would like to make is we need to make sure that we optimize the program's online landing page. Stakeholders new to the organization, for instance, the volunteer peer leaders, will need context of the awareness campaign. Besides the capacity building sessions, we need readily available information that we will give in order to facilitate the recruitment process for people to volunteer, but also for people to come into the awareness campaign. It's been identified by researchers that new participants will have a high likelihood to act as if they understand the campaign. We want to make sure that we have such a great optimization of this program that leaves no room for error. This is my proposal for the new awareness campaign for the HIV STI prevention program. Thank you so very much.